In the Star Trek movie series, my favorite moments comes, I think, in number 4, The Voyage Home, where Dr. McCoy is adamant about not leaving Chekhov at the mercy of 20th century medicine. We're now in the 21st century, and we actually have a $1 million prize being offered to the first team that can develop the first tricorder, which is important. It has to be ready for McCoy back in the 23rd century. Today we're taking a look at a paper in JACC that is entitled Plaque Trek, to boldly go where no man has gone before. And we're talking to Dr. Paul Schoenhagen, who is at the Cleveland Clinic. Diagnostic radiology is his specialty. And we're talking about a paper that he is commenting on by Noguchi et al., suggesting that high-intensity plaques identified using non-contrast T1-weighted MRI are significantly associated with coronary events. And before we talk about your commentary, which, by the way, I loved, it was very well written, entertaining, and informative, can you talk a little bit about this paper by Noguchi et al.?
The original paper is a paper by a group in Japan, Dr. Noguchi and his colleagues, who describe a technique to image vulnerable coronary plaques with non-contrast coronary MRI imaging. With that technique that has been established in the larger carotid arteries, one can image plaques that have a higher risk of causing acute coronary or acute cerebrovascular events, and the increased signal on the non-contrast MRI scans reflects intraplaque hemorrhage or bleeding into these coronary or carotid plaques. In carotid plaques, the increased T1 signal has been shown to predict cerebrovascular events in multiple studies, and that has actually been summarized in a meta-analysis. And more recently, the technique has then been applied to imaging of the coronary arteries. And the paper by Noguchi and his colleagues included about 550 patients that were imaged with the non-contrast coronary MRI and were then followed over a period of about 55 months. The authors had about 55 cardiovascular events during follow-up and found that the presence of increased signal or plaques with increased signal on the coronary MRI are a strong predictor and a strong independent predictor of coronary events during follow-up, which would demonstrate that the non-contrast coronary MRI can identify these vulnerable plaques that exist in the coronary arteries and are associated with future cardiovascular events.
So you think it's time to move out of the carotid artery and start perhaps thinking about this more broadly?
The method has been established in the carotids, but the paper by Noguchi and al. Shows that in the smaller coronary arteries, which are always more difficult to image, particularly with non-invasive modalities, the technique can also provide reliable results.
So where do you think this is going in the next few years? Cost is always an issue, but this is really exciting new imaging technology that has some real potential.
Yeah, the coronary MRI is a difficult modality which is currently performed in relatively few advanced imaging centers around the world. The next step for an imaging marker like the one described in this paper would probably be to apply it in pharmacological intervention trials to see if a certain pharmacological intervention, a new medication, can affect or can affect the presence of these vulnerable lesions or has an impact on vulnerable lesions. I think that would be the initial step I would be more reluctant to consider that technique, an imaging marker like this, would be ready to be applied to predict outcome in individual patients.
No, that makes perfect sense. Now, one of the things you also talked about in the paper was how artificial intelligence, such as Watson, might someday have an impact on this whole area of imaging.
Yeah, I think that is a very exciting area in cardiovascular imaging or imaging in general, that the image has already over the last 2 decades moved away obviously from an X-ray film to a completely digital evaluation of images in advanced three-dimensional software. And increasingly these workstations become basically intelligent workstations or smart workstations that provide decision support and image reconstruction in the background and present certain parts of already processed data to the reader or to the imaging specialist, who can then include these semi-automated results into the analysis and eventually into the report. And that is an area that is evolving very fast, and I think is a very exciting topic for the next couple of years.
Now, you've done some of the research yourself in this area, which is why you ended up writing the commentary. And Jack, what are you working on right now? I mean, what needs to be done next?
Yeah, I would think really the next step, the most exciting step, would be the application in pharmacological intervention trials to see if one can show that risk factor modification can impact the presence and the frequency of these vulnerable lesions, and if the pharmacological intervention or the risk factor modification in general has an impact on these vulnerable lesions.
I think it's an exciting area, and I think we have a lot more to learn, but I really appreciate your time here, and I really appreciate the commentary you wrote in, Jack, because like I said, it's entertaining and very informative too.
Yeah, that was my goal, to summarize what I think is a very important clinical topic, but also provide the editorial in a more entertaining fashion.
Well, thank you to you and the folks at Cleveland Clinic for helping us out here. For Cardiol Source World News, I'm Executive Editor Rick McGuire.